Hi everybody, it's Catherine here, and today is January 25th, 2024, and I am on my second round, 1 year later, of the 5FU, 5-fluorouracil treatment. My doctor had recommended that I do a second treatment a year later, and I happily obliged because I really thought that it was a very, very good idea. And rather than doing a day by day, I thought I would go through the 14 days in 2 5-day increments, and then maybe the last 4 day by day. There's no point in you saying what you saw a year ago, same month in January of 2023. But I wanted to give you a close-up of my skin. So I've been treating it for 5 days now. And I am just now starting to see the redness and getting a little tiny bit of that prickly feel that those of you that have done the 5FU would know what it felt like. It's just little tiny little prickles, almost like you have a little bit of heat rash. But just a reminder, 5FU is not a wrinkle treatment. It doesn't get rid of melasma. It is only meant to treat basal cell carcinomas, actinic keratosis before they turn into skin cancer, as well as some squamous cell before they become in situ, is what I understand. So these are the things I'm focused on this treatment. Number 1 is going to be my eyebrows, which was a huge concern of mine last year, and they did flare. Secondly, this area right across here. And if you go back and you look at my other videos, I did a day by day, and you can see the progression of how the treatment worked for me. It does work differently on every different person's skin, and you can most definitely expect that your skin may not react like mine. But I am putting chapstick on this before I actually do the treatment. And the reason being is the doctor said that that was a blood vessel, and it became really, really like kind of red and inflamed and then kind of went away. And that's kind of how it's been sitting for the last year. So he's still watching that, but he reassured me that it was a blood vessel. So that's what we're going with. But the treatment ends along my jawline right here. And I am kind of focused on this area right here as well, in my temple area. You know, where your sunglasses were that, you know, we're kind of reflecting. But outside of that, nothing too much to report other than, you know, I'm starting to get that slight redness. So for those of you that don't know, I had a Mohs surgery. This was my ear. They took cartilage out of my ear, and unfortunately basal cell carcinoma actually pretty much did my nostril in. So that's why you see such deep marks right here from the reconstruction of this nostril. So, you know, another reason I firmly believe if you can get this treatment done and get it done effectively, it may prevent you from having to have such a serious surgery. I wasn't so lucky. So anyhow, I would highly recommend go back if you haven't seen any of my videos before. I have a whole playlist of videos from day 1 through day 21, and then my healing process. And it will absolutely give you an idea of how this medication works and how well it works and how well you heal. It's not going to make you cancer-free or skin cancer-free, that's for sure. You're always going to have cells turning over for the rest of your born days. It's all damage that you've done from being out in the sun, and as your cells turn over, they just kind of creep their way to the top. But you know what? If you can effectively kill them off, it will prevent you so many different things, in addition to going to the dermatologist and getting, you know, the 9 sprays on your face or whatever it is that your doctor does. And then waiting a year and wondering, oh God, now what am I going to have? It really does show you exactly where your problem spots are, and this way you can focus on them. And then once you're done with your treatment, you can focus on, you know, protecting your skin even better. I never gave that much attention to my eyebrow area. I mean, I would put my sunblock on, but it wasn't always hitting my eyebrows and really kind of getting in here. And boy, I'll tell you what, it does now. So anyway, I will see you on day 10, and I most definitely can see that I'm gonna flare. So it'll be interesting to see exactly what it looks like now versus what it looked like a year ago. And I hope you come along on the ride with me. Please like, subscribe, mostly because I would love to be able to continue to show you the progress that I have throughout whatever it is with this skin cancer journey, so that it can, you know, help you. So thank you so much, and share with anybody that you think may benefit from some serious talk about sun damage and what it really does. So thanks again, and I'll see you in 5 more days. Bye.